Hello, my name is Dr. Sina Reangber, and I'm the owner of Lifetime Smiles in Haymarket, Virginia. And I get a lot of questions about dental implants. Dental implants are a procedure that replaces a missing tooth or multiple missing teeth. They're typically recommended when patients need an extraction. For example, if they have a really broken down tooth that we just can't save anymore, then the recommendation most of the time is to take the tooth out and replace it with a dental implant. A dental implant basically is a titanium screw that gets placed into the jawbone, and it's basically mimics the root of a tooth, and then we put a crown that goes on top of that dental implant. And when you look at it, it looks just like a tooth. What conditions might disqualify a patient from dental implants? So dental implants are done thousands of times a day, probably many thousand times. But some things that might disqualify a patient is if they're a very, very heavy smoker, if they have uncontrolled diabetes, sometimes if they have other health conditions that increase bleeding time, things like that, that may disqualify a patient. What benefits and risks are of a dental implant? So let's start with what the benefits are. Really, to replace a single missing tooth, the best option is to get a dental implant. The implant actually mimics the root of a tooth. It helps stabilize the bone in that area so you don't lose bone in the area where the missing tooth is. It doesn't affect the adjacent teeth or the two teeth or the one tooth that's beside it. It helps restore the teeth or help keep the teeth above or below it in that same position. Some of the risks are it is a surgical procedure, so there are some minor risks with that. In terms of some of the other cons of it, I would say, is it does take time. So a dental implant has to be surgically placed, and then typically that is placed in the bone to let the bone integrate or let the bone heal around the implant for anywhere from 3 to 6 months, depending on the condition of the bone, the health condition of the patient, the area where the implant is being placed. Once that heals, then it can be restored with a crown that takes about 3 to 4 weeks to get fabricated. So that's one of the downsides of it. The last one is cost. Cost is really relative. It's very similar in cost as doing a dental bridge. It actually, in the long run, is cheaper than a dental bridge because a dental bridge basically is putting a fake tooth with two adjacent teeth, kind of bridging them together. So you have two crowns and then a floating crown, and they're all connected. That is going to need to be redone much sooner than the implant. So the costs will actually be less in the long term for the dental implant. Different types of dental implants. There are hundreds of types of dental implants out in the market. For the most part, they're all very good. It just depends on what the doctor or the surgeon uses and what works well in their hands. Most of them are made out of titanium. There are some zirconia implants, but it's not very well known. It's not done very often. Typically, the zirconia implants are done for patients who have an allergy or don't want any type of metal in their body. From what I know, they're not very well known. There's been a lot of cases where they used to do them and they've broken or they've cracked. So most surgeons that I know don't place dental implants that are zirconia, but the majority of them are going to be titanium. How a dentist is going to determine whether a dental implant is right for our patients. So one thing is, if it's a single missing tooth, the best option would be to replace it with a dental implant, especially if the adjacent teeth are what we call virgin teeth. They have no restorations, they don't have fillings, they're just really good, healthy teeth. If we do anything else like a bridge, that means that we have to touch those teeth. And every time we touch a tooth, it's going to have to be redone. So the best procedure would be to get a dental implant. The other reason we may recommend it is if you have really good bone and it's the very last tooth in your mouth, the only option would be to get a dental implant to replace that missing tooth. So that's one reason why they would recommend a dental implant. What are the steps to getting a dental implant? Well, first of all, you need to see the dentist to determine what's going on with the tooth that you're having a problem with. Is it something that can be restored, or is it something that has to come out? Is it one tooth or multiple teeth? Once that is determined, then you would have either your doctor that you're seeing, or they may work with surgeons or periodontists. They'll determine what the course of action is. They will take the necessary x-rays. Sometimes they take a cone beam CT and come up with a plan of putting the implant in place. They will tell you about, especially if it's a front tooth, they'll talk to you about maybe a temporary implant crown or what they call a flipper, sometimes even a bridge, in order to replace that missing tooth while we're waiting for the implant to heal. Typically, if it's a back tooth, a lot of times patients don't want to do anything to replace it while they're in the healing phase, but definitely in the front of the mouth, we do talk about different options for replacing the missing tooth while you're in the healing process. What are some options of fake teeth or artificial teeth when patients are missing teeth? So really, three options when patients are missing teeth. One would be replacing them with dental implants. One would be with dental bridges. One would be with a partial denture. So partial dentures are either acrylic, which is the pink stuff. Sometimes they're hard, sometimes they're flexible, or they can be metal and acrylic. So those are the ones that have some metal in it, and they have hooks, or what we call clasps. Those are partial dentures. You can also have a complete denture, which is all fake teeth. The other option would be a dental bridge. So those are basically, we would prepare the two adjacent teeth with crown preparations, and then we restore it with a fake tooth in the middle. They're going to be connected together, and they get glued on or cemented onto the tooth or the teeth. So it looks like three single teeth, but on an x-ray, we can tell that there's a missing tooth underneath it. And then lastly would be the dental implant, which is a titanium screw that gets placed inside the jawbone, and then it's replaced with one or multiple teeth on top of it. So really depending on, is it one tooth that we're placing, two teeth, four teeth, a full arch, is going to determine the type of restorations that we're going to do prosthetically. How long does a dental procedure last? Well, it really depends on a lot of factors. It depends on our patient's diet, our patient's health, what medications they're taking. Are they good with their home care? Are they visiting their dentist regularly? Are they brushing and flossing at night, especially? So it's not really one thing. There's many, many factors that are going to affect the longevity of how long something is going to last in a patient's mouth. If they're getting a dental implant, what type of anesthesia we can do for them. The most common thing, especially if it's a single implant, is just local anesthetic, like what most people know as Novocaine. So some patients do want to be sedated for it. And again, sedation comes in different forms. They can get IV sedation. They can get just a medication like Valium to just kind of give them some anxiety relief. Those are options. General dentists, some do IV sedation. Most can give the medications. We can also do nitrous oxide if patients desire that. But it really depends on how many implants are being placed, how long the procedure is going to be, and really what patients want in terms of sedation. Will dental implants last the rest of the patient's life? Well, again, many factors will be involved in the longevity of a dental implant. Really, one is, how old is a patient when they're getting a dental implant? If you're in your 80s, yes, it will last you the rest of your life. If you're in your 20s, you may have some things come up while you're living in this world. So is it going to last you the rest of your life? Hard question to say. Again, many things will affect the longevity of a dental implant, like brushing, flossing, the forces that you're putting on your teeth. If you're clenching your teeth and putting so much load on these implants, they may not last as long as we would like them to. So can it last you your whole life? Yes, but there are many things that can affect that. What are the costs involved with dental implants, and is there financing available? Yes, our office does offer financing through third-party companies. A lot of surgeons we work with, if we're doing, full mouth reconstruction, things like that, they also work with multiple companies, and depends on what you need and how many implants. So yes, there are financing options available. And if you'd like to learn more about whether you are a candidate or in need of dental implants, please give us a call at 571-248-0700, and we'd be happy to discuss it with you.